Hi there, it's Kate. I thought I would share my experiences from the third trimester. I noticed on my other videos that the camera was like kind of shaky because I was sitting it in my lap. So hopefully this is a little bit better, but these are pretty informal. So here we go, I guess. At the time of this recording, I'm 36 weeks pregnant. So I'm not to like the end, of the third trimester, but I wanted to make this and be able to get it up since we're like in the home stretch and anything can happen and all of that. So the next video I get out, and I don't know when that will be like after the cesarean and talking about how all of that was. But definitely give me time on getting that out. Um, yeah, let's just talk about the third trimester with the TAC and everything. So starting, 28 weeks, I guess, starts the third trimester. And I talked about my 28-week appointment in my last video. So watch that if you're interested. Um, but I guess like the biggest highlight was at 32 weeks. I had another growth scan, which I also mentioned in that last video, and everything looked really good. That was our last growth scan, and that one was really cool. That was probably one of the um, I don't know. It was really cool. We got to see the baby breathing um, on the ultrasound and everything. And of course, they try to do the 3D images, but it hasn't ever really worked out well for us because she has like a lot of cord in front of her face, and so sometimes like her facial features, like her nose, will look distorted because of they have to kind of be in the right angle and stuff. But we did get some pictures, but like most, I guess, normal pregnancies, we will have to just be surprised with how she looks when the day comes. So that was 32 weeks. And then appointments from here on out have been normal for me. So that's just like going, they do the Doppler on your stomach and, ask questions and all of that and send you on your way. So that happened. Like my 30-week appointment was just a Doppler. The 32-week was the growth scan. 34-week, just the Doppler. And then 36-week, which I just did. Um, they, my hospital, like still required me to do a GBS, a Group B strep test, even though there's like no way that this baby can like go through my birth canal. But she said it was required for all patients, and my doctor even kind of admitted, like, yeah, I know this is like pointless, but I have to do it. But it wasn't that big of a deal. I mean, it's not that big of a deal. And then she asked if I wanted a cervical check, and I was like, do I really need one? Because I didn't think my cervix could open. And we kind of talked about that, and I said no, I don't want one. And she was like, okay, good. So um, a couple things that have happened throughout this third trimester is I have been in triage a couple times. So I was in triage once because I was freaking out about fetal movement. It like I felt like I hadn't felt her move as much. I would feel like, a kick or something here and there, but it wasn't like usual. So I went into triage to get checked out because I was concerned. They did the fetal monitoring and for like an hour or two, and she was fine. I still didn't even feel anything when they were doing the monitoring. Like I still didn't even feel her move when I was there, but she was fine. And so they sent me home, and then it wasn't till like 8 o'clock that night that I really started feeling her kick again. So I'm not sure what the deal was that day, but I was just I was just like, when in doubt, go get checked out because yeah, I don't know. The anxiety is for real in this pregnancy. And then actually last week I was in triage again because I was having lower pelvic pain, and I woke up at 5 in the morning and I had that, and it didn't matter how I laid, if I was on my left or right or kind of sitting up, I still had lower pelvic pain. It wasn't super painful, but it never went away. And so it was like 1 o'clock that same day, and I still had it. And I was like, well, I better call. So I called the after hours number, which is like a whole nother thing in itself. But my hospital has like an after hours number that you call, and like these nurses that are not from my hospital will like call you back. So like a triage nurse calls you back, except the triage nurses are not OB nurses. So they call you back and they're like going over your history, and they're like, have you had surgery in the last year? And I said, yes, I had an abdominal cerclage placed. She goes, I don't know what that is. And I said, well, maybe I should be talking to somebody else. And she's like, no, 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 could you spell it for me? Which I'm like, oh my God. And this is the second nurse that I've talked to from this telephone system that has asked me to spell cerclage that did not know what it was. So anyway, so I did, and then we go through all these questions that they're asking you, and then she basically says, you go into triage or not. So she told me to go into triage, and I'm thinking, I don't think I'm in labor, but I didn't know what to do. So and came and picked me up, and we went into the hospital, and I told them I'm here because I was told to be here, but I'm not even really sure, like, if this is anything. So they monitored me for 4 hours, and I guess I was having contractions, um, like I'm assuming Braxton Hicks contractions, but I was having contractions, and eventually they did like dwindle down, and I still was having like honestly like pain and stuff when I left, but they weren't concerned about it. And then I woke up the next morning and I was fine. But then a couple days after that, I started feeling crampy and kind of like that same sensation again, and then it's been gone for a couple days too. So my doctor just told me that like at this point in the pregnancy, like I am going to have, practice contractions, like I am going to be feeling that, which is so nerve-wracking to me with the cerclage, but nobody else seems to be concerned about it except me. And she said I will seriously know, like if I am having contractions and going into labor, like I will know. And she said it won't just be low down, it'll be like my whole stomach. So I'm like, okay, okay. Another thing, I have a few more things to share about the third trimester. I guess it's been more eventful than I thought, but less related specifically, I guess, to the cerclage. I mean, because they're not checking it anymore. So, um, my C-section, they were going to try to schedule it at 39 weeks, and then my doctor is going to be out that day. So then they scheduled it for like 39 weeks and 4 days. I was really nervous about it being that far back, and very nervous because I'm was like nervous about going into labor and stuff. And so then when I talked to my doctor at my 34-week appointment, I was like, can we move it up to 39 weeks in 1 day? Because like she was going to be out at the 39-week mark, but like, are you going to be back the day the next day? And she was, and so she was going to check into that, and they ended up scheduling it. So I feel so much better having it 39 weeks in 1 day. She said the reason that they like something with anesthesia and their schedule, and they like to do the C-sections on certain days, but she was like, "Oh well, like, we're doing it." So, right now I think I'm like the only C-section scheduled for that day for now. And yeah, so I feel a lot better about that, but I could still go into labor before then, so who knows. But the goal is to hopefully just hold out until then, and then yeah, I can just wake up and roll in and go have my C-section and not be in labor. Another thing that I really put a lot of time into this trimester was creating a birth preferences or birth wish list, as I like to call. Plan just sounds too definitive, and as everybody watching this video knows, like, things don't always go to plan. But there are a lot of things in a vaginal birth that I feel like, you know, we miss out on or kind of get thrown to the wayside with a C-section. And more hospitals are doing like family centered practices with cesareans, but that's not always the case. And I don't think that my hospital is necessarily like a family centered uh, cesarean practice, I guess, but I have asked for some things that they are able to accommodate. So I wanted to share that in case this is the situation for you as well. So the big thing for me was having skin to skin in the OR. If that was at all a possibility, like if baby was okay and if I'm okay, I really want to have skin to skin in the OR like as soon as possible. And in a perfect world, I would love for them to just like take out my baby and just like put her on my chest. But the doctor did say what they can do is, they'll bring the baby out. They do delayed cord clamping, so they will like set her on my legs and do the delayed cord clamping for a couple minutes, and then baby goes to the NICU team, which I guess they have at all of the cesareans, and they will like clean out her nose, wipe her off, put a diaper on her, and then bring her to me or give her to my husband who can bring her to me. But she said, totally, we can do skin to skin in the OR as long as everything's fine. But I just told her, like, with the NICU team, they can just do as the basic minimum. Like, if she's okay, obviously, if there's issues, that's totally different. But like, clear out her nose if they need to do that, but, like, if they don't, like, absolutely need to wipe her down all the way or whatever, just, like, put her on my chest, I just think that the anxiety is not going to go away until I'm holding my baby. So, she said they can do that. Another thing we talked about is having a clear surgical drape, and she said that she's pretty sure that they have clear drapes there, that really not a lot of people request them, but she said she's almost positive that they have clear surgical drapes. So I'm really excited for that, to be able to like kind of see the baby come out. And if they don't, like they can lower the blue surgical drape at the time of her delivery, her birth, so that we can see. And also, we are keeping the placenta. I've opted not to do encapsulation, and I know that's like a whole other thing, but we're not doing encapsulation, but we are going to like get it dehydrated, I guess. The kind of like the same process they would do for encapsulation, and we're going to plant that with a tree. So kind of like mix it with the soil and plant with a tree. And I really liked the idea of that because we have planted um, flower, like a rose bush and a butterfly bush for our other babies. So I still kind of liked the idea of doing something for this baby too. And yeah, I just thought it was really cool. So there is a uh, I don't know what they're called, a placenta specialist in our area, and it's not very expensive at all. And so she's going to pick up the placenta from the hospital, and she does like a cord keepsake where she dries the umbilical cord and can kind of like make it into the shape of a heart and makes like a print of your placenta, and then we'll dry it. And she said that I can like, mix it with compost or dirt or whatever we want to do with it, basically. So that's totally weird to some people. It took me a minute to get my husband on board. But yeah, so that's what we're going to do. So we discussed that as well. And basically on my birth preferences, we just put things on there for like if the baby needed NICU time, that we want my husband to stay with the baby if I'm not able to, and newborn care and my preferences for feeding and things like that. So that's kind of basic, but it was just one sheet of paper. It wasn't anything crazy. And then I also at the top of birth preferences put like our history, just like three bullet points of kind of like first pregnancy, second pregnancy, and then here we are. So I think yeah, that was good. So she scanned it into my chart, and I have some copies in my hospital bag to take too. So just in case if it ends up that I go into labor and I have to have like an urgent cesarean in some way, or my doctor's not there because it's the middle of the night or whatever, hopefully they can still accommodate some of those things. So I was really happy, about the delayed cord clamping, the skin to skin, and the OR, which was just like the biggest thing for me. And they're like totally fine with, you know, you can do what you want with the placenta. I just have to sign like a paper because it's a biohazard, I guess. So it's not exactly like a vaginal birth, and I think everybody that's kind of ended up in this situation, like, you just kind of work with the cards that you've been dealt. Like, in a perfect world, I would have loved to have, like, a non-medicated water birth. That would have been, like, my dream, I guess, birth. But it's just not how it's meant to be, and so, I felt like this way, at least, it was the closest to getting my wants met that my hospital, I guess, can accommodate. So I wanted to share that. I'd be interested to know if your hospital has like family centered practices because I have seen videos online where literally in a C-section they pull the baby out and then the baby like goes underneath the drape and they put the baby on mom's chest and like do weight on the cord clamping and everything. So I would be interested to know if you are going to be at a hospital that does that or that will accommodate that. I hope that more and more hospitals and practices start to do things like that, or at least, I don't know, have the option, because I don't know. I just think that would be really, really cool. So that's more or less um, kind of the third trimester and things that I've been through. I am finally off of the antibiotic. I've talked about that in my last couple of videos about the UTIs and everything. And when I went in for my 36-week appointment, I was like, I really want to see about getting off of this for the last few weeks. And she said, totally fine. Like, worst case scenario, if it comes back, we'll treat it. But like, hopefully for 3 weeks, I can hold out, and things have been going really well in that department, so to speak. So just just taking a break from the antibiotics would be lovely. Oh, one more thing. This is really kind of going into postpartum, but we did set this up. Um, in the third trimester is we hired a postpartum doula, so she can come in and help a few times a week. I'll talk about more of that in like the video that I make that's like postpartum or about the C-section and stuff. But something that I'm really looking forward to with having a postpartum doula. We opted not to do it for the birth, just because we felt like those funds for us would have been better utilized afterwards. So that's another thing as well. So this video is getting kind of long, so I want to wrap it up. But I am going to make a video about the cesarean, and I'll just talk about if I end up going into labor before then, what's that like, or if it ends up being just a planned cesarean where I just wake up and go in and do it. Um, and then also, I want to get a video up just discussing like pregnancy after loss and what that's like because I was really not mentally or emotionally prepared for what this experience would be like, especially in the beginning. The third trimester has been a lot better in terms of anxiety and stuff, but I still get a lot of anxiety about fetal movement. Is she moving enough? Is she moving too much? I haven't felt something in a while. Is everything okay? Like, there's still a lot of anxiety around that. And, you just really can't experience pregnancy the same way again. And a lot of people don't understand that. And it wasn't something that I was expecting at all. I just thought I was going to like get pregnant and everything was going to be fine. And your brain just like does not allow it, like for me, my brain has just not allowed me to see things in that way. So I do want to get a video up about that. Hopefully that would be helpful for not to like scare or anything, but just hopefully that it would be helpful for women that are about to partake in this journey because yeah, I was not prepared at all for how my brain and emotions and things would be. So I'm going to end it there. We're almost at 20 minutes. So see you guys in like a month or two when I can get a video up postpartum and about the C-section. Bye.